If you're tossing and turning with leg pains, you may be a likely candidate for having restless leg syndrome. But how will a doctor know for sure?
There is currently no definitive diagnostic test for restless leg syndrome. For this reason, a patient's description of his or her symptoms is vitally important to a correct diagnosis of the condition. Determining the cause of nighttime restlessness begins with a detailed medical history. This is important because almost 50% of restless leg sufferers have a family member with the condition. Next, the patient is questioned in detail about all of his or her symptoms, which are then categorized according to the 4 diagnostic criteria of RLS. The first marker symptom is the presence of unpleasant tingling, aching, itching, or crawling sensations felt deep within the legs. The second symptom recognized by the RLS study group is motor restlessness, characterized by pacing, leg rubbing, and tossing and turning in bed. Motor restlessness may also manifest as short, involuntary bursts of leg movement, which usually occur when a patient is lying down. The third diagnostic criterion is that the symptoms are worse when the sufferer is at rest, but are at least partially relieved by bouts of activity. And the final marker for diagnosing RLS is symptoms which worsen at night and are distinctly more painful between 10 p.m. and 2 a.m. A patient whose symptoms fit these criteria is considered to have restless leg syndrome. However, because RLS can stem from an underlying medical condition, a follow-up blood test can reveal low iron levels, kidney disease, and diabetes, all of which have been linked to the condition. If a doctor suspects that a condition called neuropathy may be an underlying cause of RLS, a needle electromyography study, or EMG, may be conducted. In this test, small needles are inserted into the muscles to assess nerve activity. Occasionally, a doctor may follow up with a polysomnographic or sleep test. During polysomnography, a patient's brain waves, heartbeat, breathing, and bodily movements are monitored overnight. If the end result of these tests is a diagnosis with restless leg syndrome, you are not alone. At least 12 million Americans have RLS, and researchers learn more about this common condition every day.